cheapy, it is the last. And tobacco requires a lot of fuel wood. So it involves cutting of trees, first to put up the burns for drying the tobacco, and massive wood for particular drying. You know, you need a
curing
house
process.
and the curing process. 3/4 of Malawi is desert because of tobacco curing. Now, coming to revenue and disease, we did a small study at the Ocean Road Cancer Institute. This was in 2009, and Muhimbili National Hospital, and 32% of all cancers there were related to tobacco use. And this was costing the government more than $40 million. Now, at that particular time, revenue from tobacco was only $50 million. And mark you, the data at Ocean Road is just the tip of the iceberg. It didn't cover the country. And it's just one disease, that is cancer. I mentioned cardiovascular disease, I mentioned diabetes. We're not talking about people who are flown out of the country to India to do bypasses and all those complicated surgeries. So if you were to put all this together, the cost would be massive. And actually one professor that we were working with, because you know, in this country, cancer treatment is free in a sense that the patient doesn't pay, it's the government. But if you go to Ocean Road, you don't have the best drugs for treating cancer. And he said the best drugs would cost between $400 to $500 per month.
Per patient? Per
patient. And he said if the required quality drugs were to be imported in the country, the cost would be more than $500 million per year. And that is only cancer. Now, there's another colleague at the University of Dar es Salaam who did a small study at Muhimbili National Hospital looking at cardiovascular diseases that are related to tobacco use. This was 2014, and he found out that in that particular year, treatment of tobacco-related cardiovascular diseases costed the country more than $180 million. Now, if you put all that together, now I haven't gone to the environment issue because we looked at data in Tabora, which is a major tobacco growing area. Between 2010 and 11, Tabora lost trees worth more than $10 million. If you put all that together, and mark you, tobacco farmers suffer similar consequences. First, there's the green tobacco sickness, just in the handling of the leaf. They feel nausea, they feel headache, pregnant mothers become very sick, but at the same time, they also have nicotine absorption through their skins. So they are like de facto smokers. They end up with the same addiction. Majority of them smoke raw tobacco from the farm. So if you look at that, the figures of these, we call them non-communicable diseases, would be much, much higher. And the cost would be enormous. So if you put things on the balance, this issue of revenue doesn't hold water. It's definitely a loss. Maybe, Yusuf, would you like to say more?
No, I think you've said it all. The only thing I would add is that tobacco causes poverty, not prosperity. And I think, we talked about statistics and the numbers of people, but let's not forget there are individual human beings. And if somebody is a smoker and their lungs are destroyed and they get emphysema and they cannot breathe, or they have their throat, a voice box cut out and they cannot speak, or they have their hands. So it's not just about dying, it's about living. And if your hands and legs cut off because of vascular disease caused by smoking, those people cannot work anymore. And if you're the main breadwinner, because it's mostly the men in families who smoke in Africa, and if you're the main breadwinner in a family and you cannot work, what happens to the family? They just don't have money, and also they have increased medical costs. So really tobacco causes poverty, not prosperity. And the few jobs it may contribute to the economy do not match the enormous harm they do to countries.
And in addition to that poverty, the industry aggravates it because the industry gives subsidies to farmers at very high prices. And here I mean seeds, fertilizer, and pesticides. More than double the price. And they are the only ones that have these items. Now, when it comes to buying the leaf, first they will lower the grade. In Tanzania, tobacco has 21 grades, and the farmer has no idea how these grades are set. So they lower the grade, they lower the price as well. So like if the farmer believes that his or her tobacco would be grade 3, they would tell them, your tobacco is grade 5. Okay, if a kilo would have costed maybe 500 shillings, they will tell them that global prices are bad, the kilo is 200. Now, these are items that were loaned at very high prices. So at the end of the day, farmers go home sometimes empty-handed and sometimes still in debt because what they got was not even enough to pay back that debt. So kids don't go to school, patients can't go to hospitals, and tobacco is very labor intensive. 24/7, January, December. They don't have enough time for food crops, so they're permanently hungry. So it's a whole vicious circle of poverty.
What impact will this control bill have on the whole industry? You know, you've just explained the figures and the logic behind, you know, supporting ban or control of tobacco, but it's a little bit more complicated than, you know, than the surface, because the industry involves a lot of people and a lot of players. You know, you're talking about the farmers, but not only the farmers. You're talking about the people who supply inputs. You're talking about the middlemen, the retail persons. You're talking about machinery that are involved in, I don't know, curing and in manufacture of tobaccos. You're talking about the package, the guy who's printing the cigarette box. You're talking about, there's a lot of people involved in the whole industry who will be affected by this campaign. Now, first of all, what's the alternative to what, you know, to tobacco, from the farmer to those guys who are involved in one way or the other with the industry?
Before you do, let me just come in. If tobacco use goes down, then a lot of doctors and nurses will also not have jobs because there'll be fewer sick people. Continue, please.
Talking about alternatives, there are a multitude. And I have just a few examples. You know, we have farmers in Ruvuma. Ruvuma is one of the major regions that grow tobacco, and I have a specific district called Namtumbo. And when we visited this farmer in 2006, these people were paupers, not poor, but paupers. They were hungry, they were sick, children are going to school. They had sold their produce in May, and this was October. They were still holding papers. And they were in terrible situations. But then we convinced them that, you know, I told them, look here, if this is what tobacco is doing to you, why don't you just grow maize? Even if you don't sell, at least you will have food, you will not be sick, your environment won't be destroyed. And within a very short time, I think the message sank properly. And, you know, they started on their own changing, because mark you, before they go into tobacco, they were doing something else. And they know what grows better in their areas. So these farmers engaged in rice, maize, cowpeas, sunflower, sesame, soybeans. And as we are talking of now, you know, by then they had grass-thatched houses. I mean, they were real poor, but now they testify they have better houses. They're taking their children up to college, to school. They're healthy, which is most important. They no longer cut trees. And what more do you want to hear? Now, in areas where, like crops don't do well, like in Tabora, they have honey, they can do fish farming. There's a whole multitude of things that people can do. Yusuf, maybe you can say more.
No, I think you've said it all. I mean, let's just remember there are alternatives. And as Ludgard said before, tobacco growing countries are the poorest countries in the world. So tobacco, as we said before, is not prosperity. What we really need is to help these people find alternatives. And one of the reasons, many people, you ask them, why do you grow tobacco? And they say, because we don't have other choices. Because the tobacco companies will give them seed and they'll give them inputs, but they will pay for that. And they don't have alternatives. So we have to help people. Part of the problem of solving rural poverty is helping people move away from tobacco.
And you know, in addition, you know, after I talked to these people, they were so angry. So they refused to plant the crop. And these companies took them to court, you know. And, madam, now what do we do? And I said, get a good lawyer who cannot be bribed. Let's go to court. And the industry, when they had, there were these plans, they just withdrew the cases because they knew they would never win, you know. And, you know, some farmers, if they totally can't pay the debt, they would even remove their roofs, you know, the corrugated iron sheets, take it for auction, take the few belongings that the farmer have. So it's all this, we call it a lifetime debt bondage. Farmers are like slaves. They would like to come out, but they are forced to continue the farming because they are in debt, constant debt.
What kind of mechanisms are needed in order to ensure that you know, the implementation of this law is actually adhered to by member states?
You know, what you say is actually relevant not just to Africa, but around the world. The World Health Organization met in Delhi in November last year, and the Conference of the Parties, which oversees the FCTC. And they said the biggest problem we have at the moment is implementation. We know what we should be doing to reduce tobacco use, but why aren't countries doing it? And the answer to that, unfortunately, is, as Ludgard has said, you've got the Ministry of Health is convinced of the need to reduce tobacco use. But the Ministry of Health is not the only one in the government. You've got the Ministry of Agriculture, the Ministry of Trade, and Ministry of Finance, and all of these ones are under the illusion, the myth that tobacco is beneficial to the economy. They don't understand that it's harming the economy. And so it's partly a battle within governments. And of course the tobacco industry doesn't stop there. Now in my own country, we've got very good laws. Back in 1990s, we banned tobacco advertising. We banned smoking in public places. We increased the price of cigarettes. And the benefits were there for all to see. Smoking declined by 50% in South Africa. 50% fewer smoking. But the tobacco industry was losing money. So how did we try to get round? When we tried to strengthen our laws, because there were weaknesses, we wanted something called plain packaging. The tobacco industry started to bribe government officials. It hired gangsters. It supported the illicit trade. Some statistics show that the tobacco industry in South Africa spends over 100 million rands every year bribing officials and sponsoring corruption. And that becomes a problem for us. Instead of governments doing what is right for the citizens of the country, they do what is right for the big multinational companies.
For Tanzania, at least, you know, it's like we are the only ones remaining. Uganda has the best law at the moment in Africa that was enacted last year. Kenya has a law. Rwanda, Burundi, they have law. Zanzibar has a law. And lately, they came up with very good, strong regulations. We need to feel ashamed. You know, we have all these examples. And I hope we won't go wrong because we have somewhere, you know, where we can borrow leaves from. So I look forward to, you know, we have every reason to have a good law.
I want to touch back on you mentioned about the illicit trade.